guess the question that we're trying to answer here is why use health information technology? Why have an electronic health record? And you know, the question really goes back over 10 years to the IOM study, To Err is Human. And thousands of patients die every year from medical errors, from medication errors. And so there's just one small piece. If you're a care provider and you're not e-prescribing, then you're not using the best available technology in the practice of medicine. Why would a provider not want to use the best possible technology to take care of their patients? So e-prescribing is one small component, but there's so much more to meaningful use than just e-prescribing. So to kind of frame this question and help deal with some of the meaningful use myopia that we probably all suffer from, I'll go back to February of 2009, where the American Recovery and Reinvestment Act, the ARA, or the Stimulus Act, was passed. And embedded within that legislation was the Health Information Technology, Economic, and Clinical Health Act, or the HITECH Act. And I know you're used to healthcare swimming through alphabet soup of acronyms. So the HITECH Act allows for about $27 billion in incentive payments for hospitals and healthcare providers to become meaningful users of a certified electronic health record system. That's for providers $44,000 in Medicare payments, or up to about $63,000 in Medicaid incentive payments if you can achieve the meaningful use of electronic health records. This is over 5 years. In 2015, fee adjustments or penalties begin to kick in. So it's very important that if you're a provider, to understand how you can become a meaningful user of electronic health records, really not just so that you can receive some incentive payments which are transitory, but so that you can participate in the long-term goals of healthcare using technology. You've probably heard of the medical home model of care and accountable care organizations, and the entire healthcare system is changing, as we all know, and most of these changes are IT enabled, they're technology enabled. So I'll get back to the incentive payments in just a moment and briefly outline some of the other provisions in the HITECH Act. The Office of the National Coordinator for Health Information Technology, or the ONC. The ONC was founded by the Bush administration, not funded very well, and substantially funded within the Stimulus Act. It was given $2 billion in discretionary funds. And so the ONC is tasked with implementing the high-tech provisions of the ARRA, the ARA. They've already released a lot of these funds, $693 million for regional extension centers. These are throughout the country to help providers to achieve meaningful use. Whatever state or territory you practice in, if you practice in the United States, you have a regional extension center near you, you should contact them, because they've been tasked with assisting providers in achieving meaningful use. So find out who your regional extension center is and contact them. $118 million have been designated for workforce development. It's estimated we'll need 40 to 50,000 new health IT workers, and that's going to be difficult over the next couple of years to achieve. So community colleges and universities around the country are ramping up programs now using these funds to develop curriculum and begin training the necessary health IT workforce. There's $564 million that has been allocated to the states for health information exchange planning. A critical component of meaningful use, as we'll see in a moment, is being able to exchange relevant clinical information across transitions of care. And $60 million was dedicated to the Strategic Health IT Advanced Research Project, or SHARP projects. And there's 4 of those around the country. The one here in Illinois is working on privacy and security, and a lot of good research hopefully will come out of that. So meaningful use has been described as being stood up on 5 pillars, and those are coordinated care, quality, safety, and efficiency, privacy and security, improved public and population health, and patient and family engagement. And with these 5 objectives, that really describes what the purpose of meaningful use is. In order to achieve meaningful use, there's some fine-grained objectives that you will need to be able to achieve. And there's actually 25 measures, and then 15 of those are required, and out of the 10, what they call a menu set, or the a la carte cafeteria-style menu, you can choose 5, one of which has to be a public health measure. These are things like record demographics, maintain an up-to-date medication list, maintain an up-to-date problem list, having a drug allergy check, a drug-drug interaction check, and sharing information about a visit, both with the clinicians and with the patient. You'll be required to provide an electronic copy of the medical record to the patient, which is very important to people like Regina. So there's also a component in the requirements of clinical quality measure reporting. And I'd like to talk to you for a moment about that, because I think that really impacts specialists a great deal. Out of all of the quality measures that are required, there's 25, I don't think very many of them, if any of them, really fall within the scope of practice of ophthalmology or most specialists. So you're going to have to report on blood pressure management or tobacco use screening and cessation intervention, adult weight screening and follow-up. Those are 3 of the core measures for clinical quality measure reporting. And if you don't have any of those, which you probably wouldn't, then you would have to report on some of the alternative measures like influenza vaccine for patients over 50, weight assessment and counseling for children, and childhood immunization status. As you can see, the clinical quality measures that they're talking about reporting are really geared towards primary care. Most of the meaningful use criteria seems really to be geared towards primary care. But if an ophthalmologist wants to achieve meaningful use and receive incentive payments and avoid penalties further on down the line, they are going to need to somehow achieve meaningful use. Unfortunately, you can report 0. There's 0 in the numerator and 0 in the denominator is reporting. Now, the problem is you have to be using a certified electronic health record system in order to be considered a meaningful user. And the certification standards and criteria require that software to be able to deal with all of these criteria for meaningful use. So the electronic health record system that is certified for meaningful use may not be the best system for your particular practice. So what I'd encourage you to do is to find an electronic health record system that is appropriate for your practice, that helps you take the best care of your patients, and work with that vendor to ensure over time that they would be able to be certified so that you could achieve meaningful use. You know, John Glaser said something about a year ago that I thought was very telling. He said, "Don't do anything stupid just for the money." And I think that's some really good advice. So as you're looking at electronic health record systems, don't do anything stupid just so you can achieve meaningful use and get an incentive payment that probably wouldn't even cover the costs of implementation and something now that you're stuck with. Choose your horse you're going to ride carefully, because you're going to be riding it for many years now. And so with that, I'm sure some of you may have questions about more of the specifics and particulars about meaningful use, and I want to give everyone time to get over to the trade show, so I'll end that here and we'll have a Q&A.